Welcome to Your GHAPP podcast. For this three-part miniseries, we are joined by Elizabeth Goacher, physician assistant, Jeremy Davis, acute care nurse practitioner, and Allison Moser, nurse practitioner. Throughout this series, they will be discussing the emerging treatments in PBC. On today's segment, our guests will discuss prevalence, awareness, and identification of PBC.
All right, great to see you guys at this great meeting. One time we've had at GHAPP 2024. So I'm glad that we got a chance to sit down and talk about the emerging treatment landscape in PBC. I'm Elizabeth Goacher, and I am a physician assistant at Duke, and I'm here with my great colleagues who are going to introduce themselves. Why don't you go ahead, Jeremy?
I'm Jeremy Davis. I'm an acute care nurse practitioner. I practice at Gastrointestinal Specialists out of Shreveport, Louisiana. And I, too, am happy to be here. And it's been a wonderful experience so far. The treatment landscape for PBC is emerging, and we've learned a lot of good information over the meeting. And so we're excited and happy to be able to provide a little bit more insight.
My name is Allison Moser, and I'm a hepatology nurse practitioner at Rush University Medical Center in Chicago, Illinois. I was really excited to be at GHAPP this year. There was a lot of great liver content, which I think's been really exciting to see compared to previous years, just seeing all that emerging data. For PBC specifically, there's been 2 new medications that have come out, so I think it's a really exciting time to have GHAPP immediately after that.
I know, right? The timing's great, right? Because I was like, oh, good, I can get to GHAPP and I can figure out what I'm going to do and remember names and all the data. It was really perfect timing. I was loving that. So, and I am still at Duke as I work full-time as a hepatology, all in the clinic all the time. And, PBC has always historically been that little small fragment in our world. And so, over the past few years, it's becoming more something we talk about for lots of reasons. One of the things I heard at the meeting today was reference that the prevalence of PBC is going up. How do you feel about that? Is that something that resonates with you in your practices? Is it the prevalence that's going up? Is it just identification that's going up? What do you guys have a take on that?
Yeah, I've heard that definitely a lot as well. And I think it's more identification, right? So although PBC is considered a rare disease, I feel like we see a ton of it in our clinical practice. So I think it's just the identification that's really been changing.
I think the more exposure that primary care has to work, to identify nuances as far as who to send to GI hepatology, we're getting more awareness up front, especially with the MASH situation. So more exposure and more access to healthcare and more workup, and we can actually isolate and pinpoint that with our workup. So I believe that's probably what's contributing mainly to the more prevalence. We're identifying it quicker.
Yeah, more general hepatology awareness, liver disease awareness is leading to more. And it kind of makes me think about too, I think that, when we had the DAAs for Hep C come out, we started seeing a lot more liver patients just identified, not just Hep C patients, but right. So now maybe we're seeing some of the same thing. You got PBC therapeutic change in the world. So maybe we're seeing just more. So yeah, that's great. So what about, I think we had, when I think about the prevalence too, I do wonder if it's about identification as much as actual prevalence. But the statistic I'm walking away with is what is it? Ann Moore was hammering home. It's like 1 in 1,000 women over the age of 40. Right. So do I remember that right? Yeah. So, that's a lot. That's a goodly number of people. So.
Thank you for listening. For more information on this topic, please listen for parts 2 and 3 of this upcoming series.